Okay, so in this video we're going to talk about basically just blood supply to the brain or to the head. It's known as the Circle of Willis. A couple of videos I've watched, it says you could also call it the Hexagon of Willis. I don't know, but it's not too bad. We'll just go through it real quick. And then after we'll talk about like different strokes and ischemias that we could have that lead to different disorders with basically the blood supply to our brain. So there's two ways our brain could receive blood supply. It's going to be through the spinal cord, mainly the cervical vertebrae, which we'll talk about, and then through the internal carotid artery, which we'll also talk about. So for blood supply through the spinal cord, right, we have our heart like right in the center of our chest, mainly to the left side a little bit, and then blood flow is going to go right to the cervical region. When it passes through the cervical spinal cord, right, the vertebrae in the back, there's going to be two arteries, one on the left side, one on the right side, because we're bilateral. And these arteries are going to pass through something called the transverse foramens of the cervical vertebrae. So the vertebrae, right, we know it's like a bone structure. In the middle, we have the spinal cord. And then we have foramens on either side. There are these little like holes. And through these little holes, we're going to have two vertebral arteries. So right here, you see vertebral arteries, 1 and 2. I kind of try to draw like a cross-sectional view of like the spinal cord itself. I couldn't really draw a spinal vertebrae, but if I were to draw the vertebrae, you would see the foramens right here like that. And if you're looking more posteriorly, this would be like the spine. I don't know. Just if you could kind of like get a good visual, this would be the foramens. This is the spine because it's posterior. Here would be the anterior part of the vertebrae, and this whole area would be the spinal cord. But let's keep going. Now, another way we get blood supply to this whole entire circle of Willis, as they call it, is through the internal carotid artery. Remember we spoke about a video, or we had a video on the face, right? Let me try to draw it real quick over here. That's a really bad picture of the face. Let me see. Okay, the face. Do a little nose, little mouth. Alright, so this is the face, right? Here's the neck. We said we have two arteries that come up. One of them was the internal carotid, and then one was the external carotid, right? The internal carotid, we said, mainly supplied the blood vessels in like the brain. However, it also supplied blood vessels where? By the eyes, the two optic levels. And then the external carotid artery supplied like above the auricle, like the ear, by the maxilla, etc. Just know this internal carotid artery that's going to the different structures in the brain is the same artery that's going to the areas of the face that we spoke about a while ago, the scalp and the face. So now, if we keep going. That's the two ways blood supply gets to the circle of Willis. Okay, I'm going to start from the most inferior region, and I'm just going to work up like superiorly, not too bad. So if we're starting off the spinal cord, then we're going to get to the medulla oblongata. Here's the pons. And then if I were to draw it in black another structure out here, right? Right around this region would be the midbrain, and if I keep going up, it would be the cerebellum, the cerebrum, right? So like our frontal lobe, our occipital lobe, temporal lobe, and parietal lobe. For this structure, right? So just think of this as going straight up, and then at this region, it's going to separate. What do I mean by separating? So the bottom part of it is going to be mainly posterior. It's going to be the occipital lobe, and the top part of it will be like the frontal lobe. So we work straight up, and then we just readjust this guy, right? We turn him forward, and you would see the occipital lobe in the back, frontal lobe in the front, and that's how the structures are going to be. Can't really draw it 3D on a 2D board, but you get the point. Now, the two vertebral arteries, they proceed up, and they're going to do something. They're going to branch. So arteries, we said they diverge, veins, they converge. So we're going to have a lot of different things that are converging here. First, they branch off into one artery known as the posterior inferior cerebellar arteries. I said two because why? One on the right, one on the left side. Now, why would it make sense for it to be called the posterior inferior cerebellar artery? Because we have to know the pons and the medulla, right? Mainly the pons area posterior to it. We have the cerebellum on both sides. Okay. So the cerebellum was posterior to the pons and medulla region of the brainstem. How do they even make connections? Well, for nerves, they had, this would be the middle cerebellar peduncle, and then this would be the inferior cerebellar peduncle, right? If in the nerves videos we said that, that's how the nerves pass through the midbrain and the pons to get to the cerebellum. And then the medulla and the pons. And then for the midbrain, we had something called the superior cerebellar peduncle. I'm not going to write it all in, I don't have enough space. But, as I was saying, these two regions, right, they feed into the cerebellum. They're going to have arteries that flow into them. The first one is posterior inferior cerebellar artery. Okay, this is known as PICA, P-I-C-A, the PICA artery. Okay, if you proceed, not if you proceed up, now, branching off of the posterior inferior cerebellar artery is going to be another artery. This artery is going to be known as the posterior spinal arteries. Okay, so if this is in the posterior part of the cerebellum, so that means, it's a posterior artery, that means it's in the cerebellum, which is posterior in our body, because we know anterior, posterior. The spinal arteries that are going to be proceeding downward, they have to be called posterior spinal arteries because they're in the posterior region of our brainstem, or in our body, sorry. Now, those two arteries are done. We proceed upward. As we proceed upward, the two vertebral arteries, they're kind of going to converge, right? We just said most of them diverge, but right here they're going to converge. When they converge together, they're going to form this thing called the basilar artery, kind of in the pons region. This artery is going to have a lot of things forming with it. But before we say the different things that branch off of it, we have to mention two things. Two arteries, right? One from each vertebral artery, because they're coming from the vertebrae, are going to branch off and fuse together, and they're going to form something else. These guys are going to form the anterior spinal artery. Okay. So if the arteries that go to the cerebellum are the posterior spinal arteries, and they supply blood for the spinal cord on the posterior side, the arteries that are just coming from the vertebral column that are ascending or branching off forward or anteriorly are going to be known as the anterior spinal arteries. Okay. These arteries, if we remember our pons and medulla, mainly our medulla region, we have pyramidal desiccations for the corticospinal tract. That pyramidal desiccation is getting blood supply from where? The anterior spinal artery. I'll go over that again later, just briefly mentioned it. Now, these two arteries ascend up, right? They converge together. When they converge together, what's going to occur? They're going to form the basilar artery. Now, before we talk more about the structure ascending upwards into the brainstem, I want to keep mentioning what we have in the pons, because right here is the medulla. Here's our cerebellum, right, posteriorly. Here's our pons. If I drew it up, we have the midbrain. Okay, the first arteries that are diverging off or branching off are going to be known as our anterior inferior cerebellar artery. Why does this make sense? Okay, so we already have our posterior inferior cerebellar artery. This is further behind, right? Now, if we have another artery that's going into the cerebellum, we don't want in the posterior region. We're going to need to feed it to the anterior region, the cerebellum. So he's going to be known as the anterior inferior cerebellar artery. Okay. Proceed upwards, right? We're still in the basilar artery. This whole structure, that tree trunk, right? Two arteries are going to diverge again. They're going to be known as the Labyrinth Arteries. Basically, these guys are also known as the internal acoustic arteries. The arteries are going to branch out to where? Acoustic for ears. We'll get there. Now, we keep ascending upwards, right? Still in this basilar region. We ascend upwards into this huge structure. But before we reach this huge structure, we have these little branch points, right? These little branch points are called Pontine cerebellar arteries. Why would they be called Pontine? Well, because they're in the pons. So they're going to be known as Pontine cerebellar arteries. And they're going to feed off, and some of them are going to deviate into the cerebellum. So they're Pontine cerebellar arteries. Now, we ascend upwards. We get to this huge, bulky structure, right? This guy is going to be known as the posterior cerebellar arteries. What is the difference? Well, this is the posterior inferior cerebellar arteries, right? So inferior meaning below. This is the anterior inferior cerebellar arteries, so kind of like below. Now this big mumbo is known as the posterior cerebellar arteries. So he's the whole thing, he's the big guy for the whole entire cerebellar region. And he's where? Kind of like above the cerebellar, so it's not going to be inferior, he's going to be more superior. Now, This posterior cerebellar arteries, right, the big one, he has two structures branching off of it. So if we keep ascending up, and before we get into him, we'll get into this one. So this guy, or this girl, whatever, has superior cerebellar arteries. That's going to be what she's named. Why is that her name? Because the cerebellum travels all the way up. The cerebellum will travel all the way up here. This marker's dying on me. And this is going to be where? Superior to the cerebellum. So it's going to be the superior cerebellar arteries. This one is going to be posterior to this region, so it's going to be known as the posterior cerebellar arteries. So cool. We covered all of these structures. We're literally almost done. Now, this green region, right? It kind of looks like another spinal cord or spinal column with a gray matter. It's not. It's a really poor drawing on my part, but it's known as the optic chiasm. What runs through the optic chiasm? The optic tract, cranial nerve what? 2. So this guy's going to mainly be where? If this is the optic chiasm, and it's for the eyes, he's going to be the anterior region. Remember I said we're going to take this structure and go like this with it, or go like this with it? So this is the frontal part. This is going to be the occipital part. So the top region is going to be the anterior, so known as the optic chiasm, where the frontal lobe is going to be. And the bottom region, where the posterior cerebellar arteries are going to be, it's going to be known as the occipital part. That's how we're going to talk about it. Why didn't I just draw it like forward? Because like our brain doesn't like keep us ascending upwards. It starts separating into 2 regions, anterior and posterior. If it was a spinal column, yeah, I could keep going up and up and up. But now we're done with the spinal column, so we're going to have to go 2 separate ways. Maybe 3 separate ways, depending on the arteries we'll talk about. So, blood supply from the posterior cerebellar arteries starts to branch off. It doesn't stay as this huge bulby area. Why? Because we can't have that much blood in our brain. Our brain needs space for the blood to flow because we have big lobes. Now, it's going to separate, and they're going to go into 2 arteries known as the posterior communicating artery. Why does that make sense? Because it's just communicating with other different arteries, so it's known as the posterior communicating artery. Now, this is posterior. Remember, up here is anterior, so these would be the posterior communicating arteries. Before I talk about anything else, I think I should just mention it. If these are the posterior communicating arteries, what is this guy up here, this little branch? He'll be the anterior communicating arteries. Because we have a posterior in the occipital lobe, now we'll have an anterior in the frontal lobe. Cool. So these posterior communicating arteries, right, they're going to cross, so they're going to feed into another artery. The artery that's going to feed into them is going to be the internal carotid artery. Oh, we spoke about that in the beginning. 2 different ways blood gets supplied to our body. Through the vertebral arteries and into the, not to our body, to our brain. Through the vertebral arteries and the internal carotid arteries. So now those cross, right? So now we got a lot of blood supply. Before they cross, the internal carotid artery passes through the optic chiasm, and he gives off another artery. This artery right here on either side is known as the ophthalmic artery. Ophthalmic artery does what? Gives supplies to the eyes. Okay, so now after they cross, they're going to give off another artery. The artery that they're going to give off is known as the anterior choroidal artery. The anterior choroidal artery is known as anterior. Why? Because it's in the anterior region, and it's for the choroid. So we'll talk about that later, but just know it's the anterior part. Branching off this internal carotid artery with a crossover between the posterior communicating arteries, we have a couple more arteries that branch off, right? They're a little longer than that, but they're known as the laticulostriae artery. Okay, so the laticulostriae artery is just branching off those 2 regions. Almost done. And the arteries from the vertebral artery and the internal carotid artery, now they got to communicate. Oh, so they communicate how? They communicate via the anterior communicating artery. So from the posterior cerebellar artery to kind of like the internal carotid artery area, we have posterior communicating. And now, from the posterior, or from the internal carotid area to the other side and to this structure up here, we're going to have the anterior communicating artery. Now, what is the structure called, or what is the artery called, I should say, that is from the internal carotid to this region up here? It's not just the anterior communicating artery. It's known as the anterior cerebellar artery. Okay, so the anterior region of the cerebellum. Now, or cerebral, I'm sorry, so the brain. So from here, all the way up to here is the anterior cerebellar artery. the small region, I should have mentioned it before, just that small region, this guy is known as the anterior communicating artery. So from here to here. But this whole structure, this pink one, all the way down to the internal carotid artery, basically, is going to be known as the anterior cerebellar artery. Cool. So that is every artery of the circle of Willis and of the blood. Now it's important because I don't think the test is really going to ask us the anatomy of it. They're going to ask us more of like functions and stuff and what is damaged. So I'm going to continue, and I'm just going to have the same exact picture up. I'm going to talk about different lesions and strokes that could occur, or an aneurysm, that could occur in this region and what effects it has on our body. So now we're going to talk about different lesions, strokes, aneurysms, basically problems that could happen if one of these arteries are damaged. Now, over here you see I have aneurysms, and then I have all writing filled in that wasn't in the beginning of the video. We're going to go through it real quick. But I'm going to start off talking about like occlusions and like strokes, and then I'm going to talk about the aneurysm. So, quick recap, let's remember we have spinal cord, two arteries coming up, or the vertebral arteries. They branch out into the PICUS, posterior inferior cerebellar artery. Then this guy branches off into the posterior spinal arteries. They ascend upwards. As they ascend up, we have the anterior spinal artery. Branches into the basilar artery. The basilar artery branches off into the anterior inferior cerebellar. We have the labyrinth arteries. We have the Pontine cerebellar arteries, also known as the paramedian arteries. Right here we have the superior cerebellar arteries. Above that's the posterior cerebellar arteries. Continue upwards, we have the posterior communicating arteries. Right here is the internal carotid artery. Branching off of that is the anterior choroid. Branching off of that is the lenticulostriae artery. Branching off of these guys is the ophthalmic arteries. Proceeding upwards, we have the anterior communicating artery, and then finally the anterior cerebellar artery. Now, most of these arteries, when they're occluded, they're going to damage a different region of our brain and our body. So let's get to it. The first one we're going to talk about is the anterior cerebellar artery. So if you're occluding that, where is this guy? So we know he's from this region right here, all the way across and up. Both sides, from here all the way across and up. And what's connecting it? The anterior communicating artery is what connects both of them. Now if we have a damage in this region, right? We're going to damage mainly the primary motor cortex and the primary somatosensory cortex. Why? So now if we look down here, we have a region, right? I kind of like drew another sagittal view of the brain. And right down the middle, we have the central gyrus. And then next to the central gyrus, or in front of it, we have two different structures. We have in baby blue, we have the primary motor cortex. And in front of him, we have the primary somatosensory cortex. This red region right here, this is going to be our circle of Willis. So now, the circle of Willis, right? If these regions, if I draw them proceeding down, like through the circle of Willis, the first region that's going to hit, or that it is going to hit, is going to be our middle cerebral artery. Okay, but I just mentioned the anterior cerebral artery. I'm sorry. Well, yeah, just because I'm going to do anterior to medial second, but just so you know, the first thing that it passes through is going to be our middle cerebellar artery. Now, it goes from middle cerebellar artery to anterior cerebellar artery, if we're looking at the brain like in this angle. So now that anterior cerebellar artery, right, is going to be our two arteries in the middle. Okay, what is this structure going to represent? Well, if we have an homunculus, right, that structure that we've mentioned a couple times, where he's got lateral to medial. Lateral is going to be like the facial nerves, then above it's going to have like the arms and the hands, and then the most medial is going to be our what? Our legs. Okay, so if we have damage to our anterior cerebellar artery, which is going to be where? Our most medial, it's going to mean what? Well, then we're going to have what type of loss are we going to have? We're going to have loss of sensory or motor information on the contralateral side of the body. Predominantly where? In our legs. Why? Because it's a medial artery. Medial for the middle. Now, proceed down, we have the middle cerebellar artery, which was what? A little more lateral. What did I say? The homunculus is where? We have the cranial nerves, arms and hands, and then the legs. So if it's more lateral, what's it going to damage? Primarily the neck and the limbs, right? Head and the neck and the limb region. Okay, it's also going to damage the primary motor cortex and the primary somatosensory cortex. And what's it going to? What are we going to have? Lateral side, so contralateral loss of sensation and motor control to where? Our upper, neck, and arms. What else can we have damage? We could also have damage to the Broca's area, so we could have Broca's aphasia. What's that going to be? Our inability to produce speech. Fine. Now, the next one I want to talk about is going to be our posterior cerebellar artery. What did we cover so far? We covered the anterior cerebellar, and we covered the middle cerebellar. So boom, anterior and middle. Number 3, we're going to do the posterior cerebellar artery. Okay, where's he going to be located? Right here. This guy right over here. What did we just talk about? We just spoke about the anterior cerebellar artery, which is right here. And then we also spoke about the medial cerebellar artery. Where was the middle cerebellar artery located? Right here. Cool. Now, the posterior cerebellar artery, this one right here, is used for vision. Okay, what type of vision? And why is it just vision? Okay, well we gotta know where he comes from first. He comes from this region. We have the spinal cord, we have the medulla, we have the pons, right? Now, if you continue upwards, this region right here would be like the midbrain near the cerebral, right? The cerebral hemispheres. Okay, so these arteries, right, are connecting into the where? The cerebellar. The posterior side of it. Cool. A disorder that we're going to have is known as Homonymous Hemianopia. We've spoke about this disorder before in the video on the eyes, but we'll speak about it one more time. What we're mainly going to lose is temporal visual field and nasal visual fields. And if you see like a picture, like on the test, and you see like, honestly like this, here's one visual field, here's another, and it's on the same side, so it's like this, and like this. For the most part, the artery damage is going to be the posterior cerebellar artery. It's going to be on the same side, and I'll explain why. Actually, I'll keep this for now. So, here's our tract, right? Here's the eyes, the optic chiasm. Optic chiasm, remember? The artery, whatever. It's going to flow through, and it's going to ascend to what? It's going to hit a nucleus, and then it's eventually going to travel into the occipital lobe, in the back, right? Occipital lobe is divided into 2. Now, if you damage, say we're damage in the right occipital lobe, right? Information is going to be traveling up, and we're not going to be able to supply information from where? The left eye and the right eye. In the left eye, we're not going to be able to supply the nasal hemisphere. And in the right eye, we're not going to be able to supply the temporal hemisphere. So, if you can't supply the nasal hemisphere, right? Where are you losing vision from? Well, you're going to lose vision from the temporal side, or the temporal visual field. How? Okay, so here's temporal, temporal, nasal, nasal. If you damage this side, the middle side, right? Remember we said our eyes are like mirrors, and they go that way? So if we damage the inner side, we can't see the peripheral side. Okay, now if we damage the temporal side, we're not going to be able to see what? The middle side, the nasal side. So we're not going to be able to see this way. Okay, so we're going to have damage in this visual field and this visual field. That's why I wrote loss, I said lose, yeah. Lose temporal visual field in the, which side? The left eye. And we're going to lose nasal visual field in what? The right eye. That's going to be from posterior cerebellar artery lesions or damage. Another thing that we can lose is we're going to have a burning or sensory sensations. Why? What did I say? Spinal cord, medulla, pons, midbrain, cerebellar hemispheres. Well, in this region right here, I'm going to draw it in. Our little peace sign, we have like the thalamus. The thalamus is control of what? Well, this artery helps the thalamus, and the thalamus is our relay station. So we're going to have something with this artery being lesioned. We're going to have something known as Thalamic Syndrome, or Thalamic Sensory Syndrome, right? This syndrome is going to do what? Cause sensory loss, and it's going to make us have like a burning sensation. Alright, not too bad. Now, number 4, basilar artery. Okay, so where's this damage going to be? right down Broadway, right in the middle. This big structure. Just a line though. So I'm gonna outline it. Not the stuff branching off of it, just the outline region. So that's the outline in black. Okay. If we have this damage, right, it's gonna be named something known as locked-in syndrome. We've spoke about locked-in syndrome before. Just talk about it quickly again. Locked-in syndrome is going to do what? The patient or the person can sit down, they could be still, right? And their eyes cannot go horizontally. Their eyes can only go vertically. They also have what? Quadriplegia. They're quadriplegic, so they're paralyzed. Why would they be paralyzed? Okay, so the first thing, this is the pons region, right? You see the midbrain, pons, medulla, medulla, pons, midbrain. What runs through the pons? We spoke about this a lot. The cortico-spinal tract, right? So the cortico-spinal tract is controlled what? It sends upper motor neurons to our spinal cord, hits the lower motor neurons, helps us with movement. Okay? If this is damaged, we're gonna be paralyzed. Now, what else? We're gonna have bilateral loss of, that's what I said, cortico-spinal tracts, and we're gonna have if both sides are damaged, you're gonna be known as quadriplegic. That's what we said. Also, actually, I said everything. Complete paralyzed, still has vertical eye movements, and they're still alert and fully conscious. They just can't move, and their eyes can only go up and down. It's very tough. I don't know. I feel bad. Now, that's basilar artery lesions. Number 5, we're going to do the anterior inferior cerebellar artery. What is he going to be controlled of? Or what's he going to do? So he's going to basically affect cranial nerve 7. Why? Where even is he? The anterior inferior cerebellar artery. It's right here. In the pons. And what region comes from like the middle of the pons, near the pons medulla junction? Well, one of them, a main one, is our facial nerve. That's cranial nerve 7. So if we damage cranial nerve 7, we're going to have what? Paralysis of our facial muscles, known as facial nerve palsy. What else? We're going to damage our vestibular nucleus. Oh, if we damage the vestibular nucleus, what are we going to have? The vestibulocochlear nucleus, I mean. We're going to have vertigo, so which is like throwing up, you're dizzy, nausea, right? We're going to have nystagmus, which is what? Involuntary eye movements, like involuntary. I'm going to have vestibular cochlear nucleus. What else are we going to have? We could damage our labyrinth arteries. Whoa, where are these guys? Labyrinth arteries is what? Our internal acoustic arteries. So we're going to have some partial deafness and tinnitus, which is what? Ringing of the ear. We could also damage our cerebral peduncles. Mainly which one? Mainly going to damage our middle cerebellar peduncle because it's in the pons, right? We said the middle cerebellar, inferior cerebellar, superior cerebellar peduncles. Pons is the middle one. If we damage this one, what are we going to have? We're going to lose coordination, balance, all that stuff. What else is in this region coming down here? Well, we also have something called the Spinothalamic Tract. What is the Spinothalamic Tract used for? He helps with pain and temperature from the body. Corticospinal did what? Corticospinal was movement. Spinothalamic is what? Pain and temperature. What else do we have? Dorsal column medial meniscus is what? Ataxia, vibration, proprioception. Okay, so lateral, anterior, inferior cerebellar artery is going to be in charge of lateral Pontine, also known as lateral Pontine syndrome. We affect our cranial nerve 7, we affect the vestibulocochlear nucleus, we affect the spinothalamic tract, and we affect cerebellar peduncles and our labyrinth arteries. It's a big mamba. Why is he so big? Well, I mean, look how big the artery looks. Look how big the thing is. So that's our anterior inferior cerebellar artery. Very big. He covers up so much stuff. Goes basically across the whole entire thing. So he's going to damage a lot. Okay. Next one we're going to talk about is our anterior spinal artery. So where is he located? Okay, we have our vertebral arteries ascending upwards, forming the basilar artery. Before they form, they branch into our anterior spinal artery, right? He supplies blood to the anterior region of the vertebral column, Now, he's going to damage a couple things. What's he going to be known as? First, what is he going to be known as? Well, where is he? He's in the medulla, so he's going to be known as medial medullary. So, no. Let me rewrite it. So it's medial, right? Medial half of, not medial half, but medial region of our body and our structure. So it's going to be known as medial medullary or medullary syndrome. Because it's in the medulla, it's in the medial region, so there you have it. He's going to damage three main things. He's going to damage cranial nerve 12. Why? Because that's where the hypoglossal nerve is. What is the hypoglossal nerve used for? Our tongue movements, right? He's going to damage our corticospinal tract. Oh, another guy who damages corticospinal tract. Why? His corticospinal tract runs all the way down from through the pons, through the medulla, into the lateral sides of our cross-section of the spinal cord, into our anterior great horn, out through lower motor neurons, right? As alpha or gamma. Now, we're going to have a loss of movement with this damage, right? On which side? Well, it's going to paralyze our contralateral side. Why? Well, because we know up here the fibers cross, so the corticospinal tract, the fibers cross, so it's going to be contralateral side. Fine. Now, the last one that's going to damage is our medial meniscus. Where does he come from? Well, remember we have tracts that ascend upwards, and when those tracts form together, they form the medial meniscus. So the medial meniscus is responsible for what? Touch, pain, vibrations, and what's the most important one? Proprioception. And where do these tracts come from? Well, they come in contralaterally. We spoke about them so many times, right? They come in contralaterally, and they ascend upwards. Now, another one I want to talk about. Number 7 is going to be our posterior inferior cerebral artery. Okay, where is he going to be? Well, let's look at our structure, and we're going to say, well, this is our anterior inferior, right? Where would our posterior inferior be? This is our anterior inferior. Here's our posterior inferior. These are known as our picas, these guys are important. Now, what do they damage, right? Well, first off, they alter our blood flow to where? Our cerebellum, because they're supplying mainly the cerebellum with what? Well, the anterior inferior supplies it, mainly posterior inferior. Also have supply from which areas? Or superior cerebellar. But we're going to talk about the posterior inferior because he's going to control a lot. Now, if we damage our cerebellum, what are we going to damage? We're going to have ataxia, right? Poor coordination. Because why? A lot of our fibers, our ascending fibers, come to our cerebellar, and they do what? They help with proprioception. Now, what else is damaged in this area? Well, we have our vagus nerve, cranial nerve 10. Cranial nerve 10, right? Vagus, let me just do that. What is the vagus nerve responsible for? Parasympathetic supply. If we damage him, we're going to have what? Dysphagia. What is dysphagia? It's going to be trouble swallowing. We're going to also have what? An inhibited gag reflex. And we might have a deviated uvula, right? It might be a little messed up. Now, one more thing he supplies. Our sympathetic, right? So our sympathetic fibers to where? To our eye. Now, if he damages our sympathetic fibers to our eye, what is going to be the problem? We're going to have something known as, we spoke about him before, Horner syndrome. Horner syndrome is controlled of three main things. Ptosis, meiosis, and hydrosis. Anhidrosis is no sweating. Meiosis is pupil constriction. And then ptosis is what? Upper eyelid droop. Cool. Now, what else are we going to damage here, right? So if we don't have blood flow coming to the cerebellum, and we don't have blood flow in this region, we're going to damage our spinothalamic tract. Again, damaging the spinothalamic tract. So we're going to lose what? Ipsilateral loss of sensation of what? Pain and temperature. Where? The ipsilateral side. Because it's going to be ipsilateral here. Spinothalamic crosses up down here. They cross, whatever. It's going to be damage to our ipsilateral side. Now, one more nucleus, or one more lesion that I didn't have originally. I put it in last minute. That's why it's over here. It's going to be our medial, or Pontine cerebellar arteries. This is going to be known as medial Pontine syndrome. He's going to damage what arteries? Well, these, right? Our Pontine cerebellar arteries. Also known as our paramedian branches. Now, this is going to cause contralateral spastic paralysis of both limbs. Why? Okay, well, we're going to have spastic paralysis because we're damaging the upper motor neuron. We're going to also have medial meniscus is going to be damaged. Why medial meniscus? Same reason. It's coming through this region right here. Right, he ascends upwards, medial meniscus, ascends. Well, this is damaged, so problems. So it's going to be a contralateral loss of touch, vibration, and proprioception. Why? Medial meniscus pathway gets fibers that come contralateral. So that's contralateral. We're going to also have damage to our abducent nerve nucleus. What is our abducent nerve nucleus used for? Controls what? Our horizontal rotation of our what? Eyes. Now, if we damage the lateral rectus muscle, right, from our abducens nucleus, our eye is going to be what? Not cross-eyed, but our eye is going to be like deviated inwards, like towards the medial section. If that's the case, we're going to have droopy eye, what? Medially. So medial eye deviation. You're paralyzing the lateral rectus muscle because the abducens nerve nucleus is damaged. So, I know that was kind of a pain in the neck, but if we know like all these 8 lesions, we should be good for the test. So, yeah, I hope it helped.